Hello, everyone. Sydney here from Hyro, and I'm thrilled to be your session host. Thanks for joining us today. Feel free to type your questions in the chat, which I'll be moderating. Our speakers today are Priyank Pandey, SVP Chief Customer Officer at Emblem Health, and Daniel Royer, AVP Customer Experience Marketing at SelectHealth, to present strategic priorities for health plans, moderated by our very own Brian Anderson. So Brian, the mic is yours.
Thank you, Sydney. I really appreciate it. And thank you all that are attending our Digital Front Door Day event today. What I'd like to do is start off with some brief introductions, just by way of, since I'm speaking, and my name is Brian Anderson. I lead our sales organization here at Hyro. I've been in health IT for a little over 20 years, and I've been in conversational AI for about 5. With me, I have 2 wonderful gentlemen from the health plan space, Daniel and Priyank, if you could introduce yourselves.
Yeah, happy to. Thank you so much. Good day, everyone. So great to be with you all today. My name is Daniel Royer. I'm the AVP of Customer Experience Marketing here at SelectHealth. We are a regional not-for-profit health plan that's located in Utah. We serve over 1 million members in Utah, Idaho, Nevada, and Colorado. And we're also part of Intermountain Health as a fully integrated health system. In my role, I oversee a lot of different areas, but specifically our member outreach and engagement strategy, as well as our marketing operations, which includes our tech stack, user experience design, and the development of our SelectHealth consumer digital products and tools, website, portal, and apps.
Fantastic, thank you.
Hi everyone, great to be with you. Priyank Pandey, Chief Customer Officer for Emblem Health. Emblem is a New York-based non-for-profit health insurer serving about 3 million members in the tri-state area. In my role, I oversee all aspects of service delivery. So that's practically our contact centers, outbound capabilities. We have physical locations in the city that are open to non-members as well as members for primarily service interactions, as well as sales and just general guidance. And also responsible, for all aspects of defining and delivering a differentiated experience for our customers, including our providers, members, brokers, and prospects. Great to be with all of you.
Thank you for that. And welcome both of you. Really appreciate your time today. And thank you for being our thought leaders in this space. Let's start off with a couple questions. I first want to just talk that health plans obviously deal with a lot of different personas. You've got prospects, you've got members, you've got providers and their staff, you've got employees, internal customers across the board, and you've got brokers and agents and probably many others that I'm not even mentioning. So we're going to try to stay very focused on the member experience, but we'll definitely get into more of the agent and provider side as well if we have time here today. So I'm going to ask both of you 2 questions, and then we'll get into some more specific questions for each of you individually. But generally, when you're looking at what are the top 3 to 4 initiatives that are important to your organization for both provider and experience, how are you looking at prioritizing those and rolling them out across your organization? Daniel, let's start with you.
Yeah, I think my first comment is I wish there was 3 to 4, and only 3 to 4 to make our lives a whole lot easier. Specifically speaking to the SelectHealth, member experience strategy, our focus is kind of on 3 main areas. One is audience definition and segmentation. So really trying to define, who we're talking to, who we're building out these experiences for. The second area is developing an engagement strategy around personalization and relevancy. And then finally, omnichannel coordination and measurement, right? That's really key to make sure that we're delivering similar, consistent messages regardless of the channel that the consumer decides to interact with us. This kind of approach forces us to think customer first, right? So it's a very outside-in mentality. We're a legacy organization. We've been around for a lot of years. There's a lot of subject matter expertise, in this industry, but that doesn't mean that's always what the consumer is looking for. And so this helps us, approach everything that we do from a consumer mindset. I think the second area I'd like to mention is self-service, right? And this really does apply across the spectrum of members, agents and brokers, providers, anytime we can create really simple to use, digital tools and applications, capabilities, it can free up, the phones for those complex conversations that need to happen across all of those different stakeholder groups, and can happen and create a positive experience for them. And then the final thing I'd say is we are focused on real-time operations. We all know that this health insurance, this industry is complex. There's a lot of moving parts to it. And so the more that we can get to real time, the more that we can create automation, the more that we can move data seamlessly, from system to system and technology to technology, the more it can improve our overall members' experience. And so, whether that's simple things like, triggering communications, triggering experiences like, changing the entire display of our mobile applications based on an interaction that our member had in a clinical setting or on the care delivery side of things. That can be a real value driver, for us, and create real great stickiness with our members for the experiences that we have.
Fantastic response. Thank you. Priyank.
Sure. And I'll probably use slightly different words than Daniel, but I think thematically very consistent, right? So, from engaging members, I'll just take a step back. I think traditionally, I'm not saying plans do this generally across the board, but traditionally plans engage members almost when they need to, right? So you're communicating out based on operational transactions or when you want the member to take an action. And obviously orienting that towards the member and having a member-centric view. So there's a definition part to Daniel's point around what are the cohorts, what are the specific types of messaging needed at different points of the member's life cycle with us, and frankly, their life, right? So there's life events occurring, but also based on their interaction with the healthcare system, what are they experiencing and what are the types of messages that we should be reaching out proactively or reactively. So there's that definition part, and then obviously the delivery against that I will say definition and aspiration. I'll also add here, I think there's, at least for us, there's also our vendor partners, our delegates, our provider partners are key, right? As part of that experience, we see that in surveys and just across the board. So making sure that we are starting to have closer partnerships with those entities, sharing not just the data, but the insights and potentially some even capability to be able to deliver consistent messages to Daniel's point, again, at the time that it makes the most sense for those messages. I think the other part that's a big focus for us is, we've invested over the past few years in significant technology migrations and transformations. And, there's obviously a ongoing journey towards that overall transformation. But having invested in those foundational areas, how do we start to stitch together the various data sources, the various data assets, the various insights that we have to be able to give a more informed interaction and experience for the member? Daniel mentioned omnichannel, so absolutely maintaining consistency of communication and engagement and messaging across those channels is also a key, I'll say, priority. And last, I know we're talking about being member centric, and it's very important, and we'll get into a little bit more of this as well later on, I think, if time permitting. But I also believe, frankly, that a happy employee, a happy agent, makes it much easier to have a more satisfied and happier customer, right? So we're focused a lot also on how do we reduce some of the admin burden, so to say, on the agent? So we talk a lot about admin burden on clinicians as an example in the provider setting. I also believe that there is significant admin burden on the agents themselves that are interacting with our members. So again, we'll get into more specifics, but freeing up kind of the physical screen space, the requirements around documentation, and having tooling to be able to assess the agent, get the right answer at the right time, so that they can truly focus on the member and that interaction more fully than they maybe are today.
Great response. What are some of the significant challenges that you both experience when introducing technologies to your organization, and how are you addressing them? Priyank, let's start with you.
Sure. I'll keep it brief. I mean, a couple of areas, and it's probably not unique to us. So one, I would say data integration, right? So at this point, we have obviously several applications that are running core admin functions as well as the engagement parts, right? They're all generating or creating data or consuming data. We've invested significantly into a data lake and other kind of, I'll say, integration ready assets, so to say. So, but being able to plug in more easily into that data lake and being able to extract the data for purposes and then maintaining consistency, right? So going back to the last question around not just being able to access the data, but how do you ensure consistency, integrity of that data throughout the life cycle? I think that's been a bit of a challenge. I'll say, and this is both a positive as well as a challenge, right? There's so many solutions that are cropping up, and so many business areas that have needs around the ability to, or the desire to interact with our members, again, at those meaningful points of time. So there is potentially a little bit of federation in terms of the interactions that are occurring. So there's I'll say a process and a people component to that to try to bring together a more, I'll say, seamless operating model, so that we are all communicating as one entity to our members. So I'll say some of that operating model stitching and process, that's been a bit of a challenge in terms of kind of integrating net new vendors that are coming into play, or net new technologies. And then lastly, this is maybe a little bit philosophical, I think just the pace of change, right? So there's a feeling of trying to thread the needle of not moving too fast, but move or kind of moving too slow, depending on what the perspective is. So making sure that we are placing bets strategically, deliberately, and in coordination with other areas. I think that's another key area of focus as we move forward.
Daniel.
Yeah, very well said, Priyank. And I think, all of that applies to us as well. In my experience, I think sometimes the biggest challenge to digital transformation is less about the integration, is more about fostering a culture to support it, right? Are you prepared, for that transformation? And for us, supporting it really means relentless prioritization, making sure that we're not getting distracted. Do the technologies that are popping up all over the place, do they align with the objectives of the organization, and does it solve the consumer problems that we've identified? The countless vendors and solutions are available. It's crucial for us to focus on technologies that deliver measurable ROI and really align with our strategic objectives. And so once we establish kind of that why, then it becomes an exercise in change management, right? So which can be a significant hurdle in and of itself. So we've invested very heavily, and we rely very heavily on educating and empowering our teams about the benefits of new technologies and tools and digital transformation, and why we've chosen specific things, regardless of whether that employee is directly connected to the implementation work. I think sometimes that's lost. It's that, oh, well, that team's not actually doing that work, so therefore they don't need to be involved. But by cultivating that culture and a shared understanding and enthusiasm, we can kind of ensure more successful adoption. But as far as the actual integration goes, and speaking from my area specifically, I think we've actually developed a really good playbook around evaluating and vetting those technologies and what we look for. Whether it's the technical capabilities, right? They have to meet certain standards, whether they're a good cultural fit with our consumer-driven approach to CX, whether they want to be viewed as a partner or just a vendor, right? All of those things go into the vetting process. And then there's like this inflection point, right, between that evaluation and that vetting to the actual implementation, and that's expectation settings. And I think that's really, really important, both internally and externally, right? What are the milestones? What are the things that you're committing to? And that you're always going to face challenges from an implementation perspective, right? You're never going to have anything run smoothly. But I think the more you set those expectations, before getting into implementation, then you have a higher chance of a successful outcome.
Thank you for that, Daniel. I have one more question for you on something very similar. So how is your organization leveraging technology to create a more personalized and seamless experience for your members?
Yeah, so this is an area we've invested really heavily in. When I joined SelectHealth about 6 years ago now, we had a lot of homegrown tools, especially on the consumer digital side of things. Spent a lot of time thinking initially about what our aspirational state, what it was that we wanted the member experience to look like. And what I landed on at the time was a less is more approach was made the most sense. But the technologies that we like, those core platforms, those core services that we offer, had to be seamlessly interoperable with each other. I think Priyank alluded to this earlier, right? Is that, how do you move data, around? How do things talk to each other? Not just humans, but the technology. How are they talking to each other? And that was our big approach to our data transformation. And so for us, personalization, begins and ends with data, but it was about going beyond just demographics and claims data and even medical history. And what we wanted to do is build a repository of, psychographic data and behavioral data that can really be used to deliver the best experience. And to do this, as you can imagine, we had to unsilo the silos, right? If you think about all the different interaction points that our consumer has with us, right? Website, portals, apps, communications channels, call center data, chat data, anywhere that a member connects with us, all of those influence how seamless the member experience is. And by bringing it together, right, this information enables real personalization. And we had to look at the tools and technology that could not only just centralize it, right? But also make sense of it, right? That was the more important part. And I mentioned earlier that segmentation and audience definition was a key objective of ours. And the technologies, right, that we've implemented over the last couple of years in data infrastructure and modeling have allowed us to create a more personalized experience, because we're not trying to hit every member with the same message at the same time. But I think lastly, our strategy had to be a multi-directional approach, right? So historically, when we think about audience definition and segmentation, and those are traditionally acquisition marketing terms, right? How do I sell another widget to a consumer? But I think it's as important, if not more important, in the CX space. And so for us, it's how do we take that insight? How do we take that data and the things that we're gleaning from it, especially around the behavioral side, and push that back out to other teams that are interacting with the members, right? So how does this data influence a chronic care plan with care managers? How does it influence call center agents? How does it influence, CAP surveys, right? It just simple things like that. So it was really important for us to not just leverage the technology to deliver a member experience, but to leverage the technology to create a better, we call them caregivers, our employees, caregiver experience that ultimately results, again, in a better member experience as well.
Thank you for that, Daniel. Priyank, at Emblem Health, consumer expectations are constantly changing. I mean, we are looking at, as consumers, we look at multiple industries like banking, et cetera, where digital transformation is happening all over the place. And I've heard in other sessions where healthcare may be a laggard in some of these areas. How are you using digital tools to improve member satisfaction and reduce friction for them on common processes like, I have a question about my EOB. What's my claim status? Prior authorizations. I need help enrolling.
No, absolutely. And to your point, Brian, I quote this often. People can look up the studies as well. Gallup does a survey of kind of consumer sentiment across industries in healthcare. Usually, I haven't seen last year's data. Usually comes in one before last. The last is the federal government, then it's health insurance and pharmaceuticals. It's us and pharmaceuticals that are really vying for that slot before last. So not a great position to be in. And it's primarily because health insurance specifically is seen as a barrier between care and myself, right? So as a member, I'm trying to access care, and this insurer is in between. So some of this stuff is also trying to make sure that we are engaging, to your point, Brian, around the points where a member is having those queries or concerns or issues, and engaging in a meaningful manner. So, and I go back to the airline example. The airline, if you have a delay, they will text you, they will call you, they'll email you, at least with the update to say, you know what, sorry, flight's delayed. No idea why. At least United usually has no idea why. But we're working on it, right? Even as simple as that, right? Starting to get to that level of proactive communication to say prior auth was received and it's being processed, and if it is denied, here's the action that we can enable, right? So I think of a simple 2x2 matrix of addressable, non-addressable, proactive versus reactive. And what we really want to focus on are obviously the addressable elements that we can do either proactively, and some are reactive, right? Claim is denied. We didn't know that it'd be denied before the fact. But what are the things we can do after that fact to be able to communicate with the member? Here's actions, here's potential, next best steps that they can take, as well as proactive. And some of these just tactically, using the tools that we do have today, right? So enhancing the portals and so forth, but getting to some of those more customized messages, whether that be through digital engagement or otherwise, and then frankly picking up the phone. I mean, some of these interactions do require a human interaction to be able to talk through with a follow-up for digital. And a goofy example maybe, but I talk about, for example, the Domino's pizza tracker, right? We need something like that, and we are looking at those types of capabilities to be able to track certain operational transactions, right? Request an ID card if I wanted it in the mail, request a form, my claim status more specifically, where is it at? Being able to give that level of visibility, which then also hopefully kicks off the flywheel of portal adoption and digital tool adoption when the member sees the value, instead of slapping it in front of them on every communication to say, go sign up on the portal. If you're able to have the conversation to say, this is what's occurring, for the latest and greatest, you can always, here's how you can find it. I'm here as well, obviously, to talk to, right? So trying to combine that human element with the digital, I think also, helps people adopt some of those digital technologies. So primarily focused on, I'll say, the addressable pieces or those operational events that are occurring through both those digital and non-digital means.
We're all members, and I think that's music to my ears, just hearing how you're making it easier for us to engage with you when we have questions. Is it simple questions to more complex questions? Similar question for you, Daniel. Like, how are you guys adapting to the ever-changing expectations, needs, and behaviors of members?
Yeah, it's ironic because I just finished up talking about data and personalization, and I actually don't personally like the word personalization because I feel like it's often overused and misused. And I mentioned this earlier. For us, a more accurate term for our approach is relevancy, right? So to us, relevancy is where data and the personalization and preference all merge together, right? So personalization on its own is certainly important, but I find that, relevant and timely interactions have a far greater impact on members. So, for example, simply, including a member's name on a communication might be personalized, but it doesn't necessarily make it relevant. So the key is to leverage the data to anticipate the consumer needs. Offer them the preferences for how, when, where they want to receive communications or interactions, and ensure that consistency is had across all channels. This has really helped us build out those personas based on behavioral motivators, right, rather than just simple demographic data. And we use that in content development. It might sound crazy, but we potentially could have 4 to 6 variations of the exact same email within a single audience definition. Why? Because we want to drive action and engagement, not simply check a box to say, yeah, we sent this out, right? We informed the consumer about this, so we did our job. No, our job is to drive action and engagement. The other thing that we focus on a lot as we bring, Priyank kind of alluded to it, right, is if you think about the consumer journey, it goes from different channels, offline, online. And what I've challenged my team with is, how do we create experiences that don't have dead ends? That's something that's really important for us, right? So there's this massive demand from the organization, the broader business, to communicate and engage with the consumer. But all too often, right? So for example, we want to schedule an appointment, right? We want to attend a screening. We want the member to attend a screening. We want to refill a prescription. All too often, though, we don't really provide a simple and easy way to convert that message into an actionable result. And so the member really is left facing, okay, well, great, now what? You've told me to do this. Now, how do I actually go through and do that? And it goes beyond just, here's slap a phone number on the communication and call this, right? Because that's not scalable. And so what that mentality does is it gets us out of just focusing on the channel or the asset by itself and really thinking about the end-to-end consumer experience. And, we will, often delay, certain campaigns or communications because we look at that end-to-end experience and say, hey, we need to refine this. We need to improve this. If we send this out, it's actually going to create more friction. And that negative experience is not worth the small, positive result from, a few members that take that action and, have a good experience. The negative outweighs that. And so, we will make sure that there are no dead ends, right, along our journey, if you will.
That's amazing. Priyank, looking ahead 1 to 5 years, what are some of the disruptive technologies that you're seeing out there, and what do you think about adapting them within your organization, and how do you see that changing your brand over time?
Yeah, I think, and some of this will be a little bit I'll say fundamental to the enterprise as well, right? It'll make us look at from a mission and value perspective, how do we deliver against that based on the technologies that are coming available? I'll say the, kind of the obvious one, obviously, is AI and continued evolution in the capabilities. I think right now we're at the phase of the augmentation potentially, or getting to that augmentation of the human, right? So we have the insights. AI can get us, a lot of creative, I'll say outputs. Some of them are noise and not really real, but a lot of them are. Using that to kind of augment our agent, as I'll say, or augment our capabilities across the board, augment the human in processes that they're doing today. So you're seeing some of the, I'll see low-hanging fruit that's being removed today. So a lot of the manual processes that could be automated, some of the decisioning and having the AI be more of an assistant to the person that's making the decision. And then, as I said, getting into more of an augmentation role. I think moving forward, you will see where, again, specific interactions. So, for example, an always on assistant that can help with the transactional, right? So quick queries that I can query my transactional data stores and get the latest and greatest, even if it's 2 a.m. for the member. Those are the types of things that you will see, I think, enter more into the forefront. I think the other part that's probably more interesting is from a pure value add perspective, going back to my positioning of a health insurer, right? But it's seen as a barrier versus really more of an advocate. And we like to think we're an advocate and a navigator for the member. But I think this is where the technologies, whether they be AI or kind of the next evolutions of those, will enable us to be serving in that role, either directly using the AI or again through that augmented agent. I'll add one other point that we haven't talked a lot about, but I do think it's a pretty big overall industry trend that's gonna have to be faced sooner rather than later, which is cost, right? So costs continue to go up. I think overall spend is almost at 5 trillion, if I know my numbers correctly. It's going to grow to about 8 trillion from an industry perspective, overall healthcare over the next 6 to 8 years. I think given that some of the technologies we don't talk about as much today, right, blockchain and so forth, that are not really operationalized as use cases in healthcare, but I think using those to deliver greater transparency across the board, right, 360 transparency around cost will be much needed as we move forward, because in the absence of that, there will have to be some kind of cost controls either that come, top down. But I do believe the bottom up approach of providing that transparency to our consumers is probably the next big wave that you will see over the next couple of years.
Thank you for that. So all three of us are patients. We're also members, and there's this thing called communication fatigue. We all get bombarded by our pharmacy, our providers, even our health plans with text messages, phone calls, etc. Daniel, how do you balance reactive versus proactive engagement with members, just to make sure that you're not creating more communication fatigue for them?
Yeah, it's a challenge, and it's definitely a balance because we all know reactive communications aren't really going anywhere anytime soon. I say the real challenge exists in the coordination. And so for us, bringing it under a single umbrella, having traditional communications and kind of the new next best actions and personalized communications and relevant communications, has helped. Making sure that we have a singular strategy and approach to outreach and engagement, so you're not flooding the member with messages. As we've dug into it, we've actually realized that many reactive communications can actually be turned into proactive ones, right? Just based on the data work that we've done. And so again, it's about anticipating the needs, and many times the data will give you the insight that you need. I think the other critical component is you have to have very strong hierarchy management in place, and then mutually agreed upon prioritized objectives by senior leaders, right? Like I said, everybody wants to communicate, but not everyone has probably done the level of analysis to say, well, are we actually getting a return on this, right? Is it actually impacting a large amount of members? Are we actually driving the behaviors and the outcomes that we need? And so, if you think about, I mentioned multiple times, audience definition and segmentation. Well, not surprisingly, a Medicare member may fall into 4 or 5 different cohorts, right? And they're all eligible for different communications. And so having that, if you don't have that hierarchy management in place, really, it's hard to measure what's driving engagement and if it's actually meeting the right KPI. So you think about, for example, if a member is a higher utilizer of ER services, Well, then the series of communications around appropriate care channel, virtual services, PCP services should and would take precedence over something more administrative or informational about, general health and wellness. And so having that in place and hopefully having it automated so the tooling and the technology can make those determinations for you, really ensure that we are not overloading the consumer with too many messages. I also mentioned preference, right? Get preferences in front of the consumer. Drive that as part of your portal adoption strategy, because I think that'll help inform, how consumers really do want to hear from us. There's consumers that want to get a text message all the time from us, right? Back to Priyank's point about, what can be, more that addressable state where it's like, hey, it's just a status update. So somebody likes to see that. They want to have that type of interaction and that information. So it's really about, having the options, having the availability of preferences, and then having that strong hierarchy management in place.
And Brian, I'll just highlight a couple of points there, right? So I just saw the stat yesterday, so I thought it was wonderful. I'll share it. Industry average from a health insurance perspective, again, the entity, right? So I'm including delegate partners and vendors potentially in this as well. On average, a health insurer in America communicates or sends about 800 to 1,000 communications per year to a member. Now that I frankly, I thought that was like not correct, but then the more we discussed, it's like, yeah, that's probably true. When you count every piece of mail, contact, text messaging, and you start to add the delegates and vendor partners and so forth, right? So it's a significant amount of volume. I think to Daniel's point, I just wanted to highlight one aspect that we have also started to look into a little bit, right? Is that the preferences are not necessarily preference across the board, right? There's certain interactions that we want to text for. I would love to get text message updates on where things are tracking. But if my PCP is no longer in network, I don't want a text message for that, right? Like I want a phone call or some human touch point potentially to help me navigate through that incident. So I think just adding that nuance as well to make sure, the right courses from a courses perspective, that's not the same, but making sure that we're using the right mechanism at the right time for that interaction. I think also important to reduce that fatigue. So you're not feeling like you're just getting a bunch of, being inundated by messages or communications.
I call it communication with purpose.
Yes.
So we'll stick with the theme fatigue. Sitting on that side of the desk, you guys probably get bombarded by vendors that are trying to pitch something to solve specific business objectives, strategies, pain points you have across your organization. How do you decide which ones you want to spend time on? And how involved are they in helping you with your overall strategy around member, provider, agent, et cetera, experiences? Daniel, let's start with you.
Yeah, so I mean, they play a huge role, in what we try to do. We certainly can't build everything ourselves, but I'd argue that we don't necessarily let what's happening in the startup space really dictate our strategy. For us, it's what is the member or the market telling us they want? What are the gaps that exist in our existing infrastructure? With technologies that we already have, and then ultimately, what's the cost benefit ratio to filling those gaps? Sometimes it's just a matter of expanding existing capabilities rather than a bunch of piecemeal solutions. The other thing that we look at is proven results, right? Regardless of the technology, are there measurable outcomes that can be substantiated? And sometimes that's super hard for startups. I come from a startup, environment, and so I fully understand that it's hard, if you don't have high adoption of your tools, that maybe it's hard to show the numbers. But and frankly, it's hard for more established companies to do that as well sometimes. But it is a good indicator of whether they're a good fit for us or not. One of the interesting things that we've done, just a peek behind the curtain, is we've actually instituted what's called our innovation steering committee recently. And so it's not just me getting hit up by vendors, right? They're hitting up every single senior leader in our entire organization. And so we've created a forum, to bring those to, and it's really helped us identify what are emerging technologies, and then we take all those and categorize them into, is this something that we need now? Does it actually meet a consumer need that we have? Do we wait, for a year or so and then revisit it, or is it not even really something of interest to our members? It's kind of our own, internal Shark Tank, if you will. But for us, I think the key takeaway is you have to consistently connect with members, right? Soliciting their feedback, performing market research, and that will help develop kind of the guardrails. So that we aren't moving too far away from what they want, because it is very hard, or it's very easy, I should say, to get enamored by a lot of the newer technologies that exist out there. But if can be very cost prohibitive if you're just implementing things that your consumers don't really find much value in.
Yeah, if this was Shark Tank, I would definitely pick Mark Cuban. Hopefully he's in the audience. He's watching us today. Priyank.
Sure. No, I think a great point by Danny. I think the only thing I will add, just more from a startup or kind of up and coming organization, when I again take a little bit of a zoom out, right? Just recently we've had even larger organizations, right? So JP Morgan Chase, Berkshire, Amazon, the Haven kind of venture that started, didn't really materialize, right? I think the reason for that, and the reason we see or how we decide at some point, one of the criteria on who we partner with is, are you born out of the business problem, right, versus the technology? So a lot of times when we talk to startups or we talk to firms that have innovative technologies, they're approaching the problem from a more of a tech perspective versus a business perspective. So I think having that, I'll say, fluency and literacy around the business problem and how you would solve for that, then the technology is the enablement, right? So I think even just the way that presentment is done, and again, obviously, even the solutioning should be more from that business problem perspective or opportunity. It doesn't have to be a pain point. I think that's really critical, especially for smaller companies.
Love it. We only have about 4 minutes left, so I'm gonna ask one more question, and we'll keep the question the same for both of you, and we'll shift to providers, because I believe there's several providers in audience today, and I definitely want to ask one question specific to their persona. Burnout is also a big part of their lives, right? Also, the office staff, they have to engage a lot on the health plan side. What are some of the things that you're doing on your end to try to help relieve some of that friction that they may see, phone calls they have to do, technology integrations they have with your systems? Like, where are you focusing there in order to help their lives and make it a little better? Daniel?
Yeah, it's a great question, and it's certainly an area of focus. Our kind of provider experience was born out of looking at our existing integrated relationship with our parent company, right? We've been around for 40 plus years. They've been around for 70, 80 years. We had a lot of internal shared services, a lot of internal shared systems. And so taking a step back and looking at those and say, what does it make sense for the system to own and operate and maintain? And what does it make sense for the health plan to own and operate and maintain? And we are a hybrid. We're not a closed system. And so we certainly work with a lot of providers that are not a part of the Intermountain family. And so it's created a lot of challenges. And I would say our overall experience was a very hub and spoke model. You kind of start at one place, and then depending on what you had to do, you got to go to this application or that application or this application. And so we thought, okay, what are the core systems that we needed to lift and shift in order to then build on top of that? And so, we've invested in, a provider data management platform, in Salesforce, and that's been really instrumental, because now we're starting to build kind of and fill the experience gaps that we've had on top of that. So now we have everything centralized the way it needs to be, everything from our processes, contracting, credentialing, all the way through. Now we have a platform that has the provider data. Now we can then turn around and provide the experiences that we want. So, we're designing out things like brand new provider portals, digital applications, mobile applications, and things like that. And so, a lot of work is being done in that area on our side.
Priyank.
Sure. I'll just add to, so again, we kind of, at least I try to take an inside out approach, right? So inside in this case being, from a provider perspective, just to be blunt, they want to get paid what they expect to get paid on a timely manner. That's 80-90% of what they're looking for, right? So on our end, when we go from that process of contract to configuration, right, making sure that we are taking the rigor, the discipline, the validation to make sure that what is actually agreed upon from a contract perspective, from a financial consistency, operational stability, from an outcomes perspective, is per expectation on that contract, right? So I think really making sure before you go live with changes or implementations of a contract that it is consistent with the expected outcomes, right? And then, very much looking at digital capabilities, right? So making it much easier to be able to interact with us in those digital forums, submit follow-up documentations, follow status, tying together interactions, so whether they take place over the phone or the portal, and being able to have that omni-channel experience as well. And then lastly, just having kind of more enhancements on communications, right? So being able to explain more clearly and in a more speak human manner, what are the outcomes from a claim perspective. So I'll pause there. I know we have a little bit of time left.
I think our session's going so well. Sydney gave us 5 extra minutes.
Oh, wow.
Yes. So we have a question from Larry. Thank you, Larry. So how are you creating trust with consumers/members? Personalization definitely helps, but what digital front door use cases have you found resonate with members that drives adoption, retention, and loyalty?
Yeah, I can take that one. To me, trust is built through accuracy and consistency. And so regardless of the digital front door, right, regardless of where they interact with you, if you have a disconnect in what you're emailing them versus what somebody over the call on the contact center is saying, that's going to erode that trust fairly quickly. And so, I've mentioned data, I've mentioned, a personalization is born out of that. But it's about consistency. It's making sure that that's accurate information and that's being shared across the organization. I think then and only then, when you introduce new functionality, new features, whatever, new digital applications like health apps and things like that, then that's the only way you're going to get adoption there. And so you start with the small things, start with the table stakes things, because if you miss that and you go for the shiny objects, then if to your point, if you haven't built up that trust, it's going to be really hard to get that adoption.
Yeah, and I'll just add real quick. I know the question was around use cases as well. I think the points of time where, again, from a member perspective, you have the most need. So that could be, some, again, from our surveys and experience tells us anything prescription related, right? So being able to access your medication in a timely manner. Anything around access to care, so being able to find a provider, being able to schedule appointments, and then I'll say the initial onboarding piece, right? So as you're a new member, you're a little bit more of a captive audience, being able to engage more digitally. I think those 3 use cases are ones that at least I've seen have the largest impact.
That's amazing. I think we have 4 minutes left. I want to talk briefly about the agent experience. Call center turnover is, always everybody's challenge, right? It's expensive to hire, train, and retain. So as you're looking at how do you improve their lives and give them a much better quality role within your organization, what are some of the technologies and processes you may be looking at or implementing already that will enhance and improve their overall satisfaction? Priyank, you want to take that one?
Sure, I can start. So I think it starts with kind of the even pre the call coming in, right? Making sure agents have the right training and so forth. And I won't go through a lot of that, but that's just I'll say foundational pieces that we try to focus on all the way from hiring date into the time that they start to nest and actually hit the floor, so to say. I mentioned a little bit, right? We want to ease the admin burden, right? So being able to present to the agent a bit of I'll say summary of what the member is calling for potentially based on their interactions with us and having a little bit more informed conversation up front. Easing the admin burden during the call. So having to categorize cases and so forth, being able to do that through capabilities that can, based on voice, be able to categorize call data, et cetera. Being able to, I'll say, surface knowledge management articles and resources based on the type of call. So that's a capability we have live in production today. And then as we look forward, being able to have, for example, case summarization. And so a validation of that versus the agent having to spend a bunch of after call time, documenting. We want to free up capacity for the more meaningful conversation, which is, I would say, the other part of it, right? We want to make sure the agent, I think going back to some of what Daniel was speaking about, has a true, I'll say, single pane view of the member's profile and what we would like for them to do and frankly, what they should be doing to drive healthier outcomes for themselves, right? So it could be simple things as getting an HRA completed or having a gap in care closed, but want to create the capacity both from a mind perspective, frankly, on the day-to-day function as well as just on the call to be able to then have a deeper conversation with that member on their additional needs. So primarily, I'll say all the admin burden around the case itself in order to kind of get the interaction in a more deeper and more meaningful manner based on the data sets that are available.
Priyank, Daniel, thank you all so much for spending time with us today. I learned a lot from both of you. Thank you for all the transparency. It was an amazing session for me. So thank you kindly. Sydney, I'll hand it back over to you.
Thank you. You took the words right out of my mouth. Was just going to thank all three of you for a really insightful session. You were definitely worth the 5 extra minutes. So thank you. Thank you again. And we'll see everybody at the next session.
Thank you.
Thanks.
Bye.